What's up, Doc Mike? Public Health on Call, by Johns Hopkins Bloomberg School of Public Health. Today's topic for January 20, 2021, COVID-19 and senior housing. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak with Juliana Bilowich, Director of Housing Operations and Policy at Leading Age, an association that includes many senior housing developments across the United States. Also joining is Sean Adell, the lead infection control advisor on the outbreak team of the Baltimore City Health Department. Our topic is COVID-19 in senior housing. If this topic is of special interest to you, consider taking a free new course now online at Coursera.org. This course was developed by experts at Johns Hopkins and in Baltimore City with Leading Age, specifically to help senior housing developments keep their residents safe. Let's listen. Thank you so much, Shauna and Juliana, for joining me to talk about COVID-19 and senior housing. And I'd like to start with the first question to you, Juliana. For this conversation, what do we mean by senior housing?
Yeah, thanks, Josh. Of course, older adults and those serving them, supporting them, have been hit really hard through this pandemic in various types of settings, housing, medical settings, et cetera. But when I talk about senior housing in this context, what I really mean is affordable senior housing. So that's what I focus on. That's federally subsidized housing of various kinds that's designated to serve seniors.
How many units or buildings around the country fall into this category?
Yeah, that's another great question. And it's these are not small numbers. So we're looking at 1.8 million HUD affordable housing apartments. And that's just HUD. That's the Department of Housing and Urban Development. But that's only one type of federally subsidized housing. We're also looking at over 800,000 units that are financed through what's called the Low-Income Housing Tax Credit Program. We also have rural housing that's federally subsidized. So again, not small numbers here.
And I imagine what this looks like in one community might not be the same as in another community.
Right. These are all very, very unique properties, or really we prefer to call them communities. And they're not just units, these are homes where people live. And each community is really different because these are public-private partnerships. So they're run by private management companies and owned by nonprofits for the large part.
So what's been the story of the pandemic in senior housing in the United States?
You know, I think one thing I can tell you about these communities is that they have felt, at best, overlooked, at worst, ignored during this crisis. And there are a lot of risk factors, not just age, for this population. The folks who live in these communities also have higher rates of chronic medical conditions, so that puts them at higher risk. Racial and ethnic minorities are also overrepresented in federally subsidized housing, so lots of risk factors there. And then in terms of income, they also have fewer resources to prepare and respond to a crisis. So all of this makes it a really vulnerable population to a health scare. And then when you pair that with a federal response that has really focused a lot on nursing homes, assisted living types of communities serving older adults, which is, of course, appropriate, but it still leaves out the senior housing that's independent living apartment communities that don't have medical care on site and sometimes don't even have PPE for residents or for staff.
Got it. Well, I want to turn to you, Shauna. You're the lead for an infectious disease control on the outbreak team working with senior housing in Baltimore. What's been the experience that you've had with COVID in senior housing?
Yeah, thanks, Josh. So my role has really been to go into a senior building senior living building, if they're asked or if there's been a lot of cases in that building, to work with the managers and the residential services coordinators on how best to implement infection control measures within that building. And particularly in the senior buildings, we focus a lot on environmental controls because that's really what the managers can control within the building setting. So things like making sure that the laundry room gets cleaned, or that the buttons are able to be cleaned in between people using them, that there are limits on how many people can go in the elevators, and that there's really good signage in areas, and that masking is being enforced in common spaces, things like that.
What about having to close common areas? Has that been something that has had to come up at different points from your perspective?
Yeah, it's definitely something that unfortunately we recommend. Also trying to figure out how to make outdoor spaces more accessible and easy to use if people do want to socialize from a safe distance, because being outdoors is so much safer than being indoors. But we do really, really encourage closing common areas, taking chairs out just to limit who can actually be sitting in those areas and things like that.
So, Juliana, those can be very hard changes for a community where people are, it's where they live, it's their friends. It's a pretty isolating experience. Suddenly you can't sit with your friends. And, people really thrive because of being around others. What's that process of getting these kinds of recommendations that Shauna's talking about been like at senior housing buildings?
Yeah, I think that you described it really well, Josh, the difficulty of keeping these communities as safe as possible, but also navigating the fact that these are independent communities, independent apartment communities. So there's a lot that housing providers can't do. I will say that, we have surveyed these types of housing providers across the country, and we have seen that COVID-19 cases are in a majority of these types of settings. We also know that housing providers are taking every step they can to keep these communities safe. That means a lot of cost burdens, but they're doing it anyway, right? Because these residents, these people are people that they care about, that they want to keep safe, and not just physically safe, not just physical health of COVID-19, but also mental health and well-being. And we know from these surveys that is the top concern of housing providers across the country, is how to manage that resident social isolation.
So what are the kinds of things that have been proven to work in different settings? Or maybe not proven, but people think worked.
Right. What's been interesting through this is that through this pandemic in the senior housing space is that our basic asks for what can get providers, communities, residents through this for the pandemic and beyond, our basic asks are things that really maybe should have happened 10 years ago. And that's exactly the things that will work and have shown to work. So it's things like improving internet connectivity. So if we're shifting as a country toward telehealth, but the majority of HUD-assisted senior housing communities don't have internet throughout the building, that is a very real and very scary digital divide that will impact the health outcomes for the residents living there.
As well as mental health.
Oh, absolutely.
Because,
absolutely.
People connect through all kinds of video calls and everything else. And if you don't have the internet, it's not so easy to do.
Exactly. And Shauna mentioned service coordination. And that's another thing. Only half of these communities have a service coordinator. So somebody who is there on site to help residents access the services that they need to age in community with dignity and health. And if only half of these communities have somebody there to do that, then their health outcomes, and again, their mental health is also at risk.
That one of the aspects of the pandemic that has exposed some underlying problems, underlying inequalities in society, but also underlying gaps in different areas. Sounds like this is not an exception to that.
Right, exactly. And I think, it's not uncommon for housers to think that they and their communities receive fewer resources because the people they serve are not only poor, but also disproportionately brown and Black. And so to think that our country underinvests in this type of really basic need, basic in terms of access to water, access to food, access to housing, somehow that got lost, and that's been made really clear during this pandemic.
Shauna, you have helped put together a course that's now available for people who work in the senior housing world to better respond to COVID-19. Tell us about why the city was interested in partnering and putting this course together.
Yeah, I think we're really excited for this course. There's, as Juliana mentioned, there's been a lot of focus on nursing homes and assisted living facilities. So there's been a lot of information and courses on especially nursing home settings and infection control. However, the senior living communities haven't had the same focus. And so it was really great to partner with Johns Hopkins on this project because it is something that we can share with the senior living communities in Baltimore City so that they can be more aware of infection control measures and other measures that they can take with their residents without us having to go on site to every single one. And it gives us a shared language and a shared background for when they do reach out to us to get more in depth with exactly how they can apply what they learned in the course to their specific facilities.
Got it. And Juliana, you're one of the faculty in the course. Is that right?
Yes, it was a really fun and hopefully helpful course that we developed.
Other than infection control measures, are there other aspects of the response that the course covers?
Absolutely. You know, it's pretty comprehensive. We talk a lot about emergency planning and staffing considerations. We also talk about things that housing staff on site, whether that's a manager or a service coordinator, need to consider in terms of responding in an operational way, how to promote certain behaviors, how to remain compliant with federal requirements. We also talk a lot about resident well-being, resident and staff well-being, actually. And what's so cool is that throughout, we interview housing providers from across the country in different roles. So they provide this real life, hands-on experience, at times with a lot of emotion, because they're just really, on the front lines, working on this every day to try to keep folks safe. It was a really cool experience.
And I imagine that this will be helpful, obviously, to people who work in senior housing, but perhaps also to people who live there and maybe to their families so that they can understand some of the opportunities to respond and be of support to their own family members.
Yeah, I think that, learning about the unique challenges of this setting, and also you said the word opportunity. I like that. The unique opportunities of this setting as well is something that can come out of this course, not just for staff, but for any housing stakeholder, really.
So we're recording this at a time when vaccines are very close to the horizon. Maybe by the time this airs, vaccines will be available, but not in very significant quantities for a number of months. Do you see senior housing as an important place for vaccination? Maybe I'll start with you, Shauna, given your role with the city health department. Do you have in mind that, look, we have people, they're living together, they're very high risk. We know we've had outbreaks in these areas. Let's get the vaccine to them to protect them as a high priority.
Personally, I do think that this group is a high priority, and I think that it presents some unique challenges as well compared to some of the other high-risk settings that we're going to be vaccinating in. The first one being that there generally aren't medical staff on site, so we have to figure out ways to get not just vaccines, but also medical personnel and people who can deliver the vaccines to these facilities.
Got it. That's maybe added to the health department's list of important jobs here. Juliana, how do you think senior housing providers are thinking about this challenge coming down the road of getting people vaccinated?
Yeah, I think that for housing providers, this is another area where they're really worried about feeling overlooked, being left out of the COVID-19 response. The folks who live at these communities are sometimes at a frailty level where if they could afford it, they may already be in assisted living or an even higher level of care setting. So that means that based on their income alone, they shouldn't be excluded from a COVID-19 response in terms of vaccinations. And what housing providers are really concerned about is equitable distribution across the continuum of folks who are at risk, but also within these communities. So what we see is a lot of ethnic and racial minority groups who have this real and deep historical mistrust of medical institutions, of vaccinations in particular, and having the right messaging to encourage vaccinations at these communities, I think, will be the number one challenge for housing providers who themselves aren't medically trained and also have a lot of other things on their plate and will have a challenge to notify, to navigate, to coordinate this type of effort.
Got it. Well, I think messaging is part of it, an opportunity for people to get their questions answered, really important, and also getting the vaccine there. So it's really accessible, and not expecting people who may be frail or not terribly mobile to get all the way across town to a place they haven't gone to try to get in line for a vaccine. That is, not necessarily a good recipe for getting good coverage and really protecting people. It sounds like this course may be updated as vaccine, science and opportunity becomes more clear. But for now, it is a way for people to really understand what's going on in senior housing and how the situation can be made as safe and as healthy as possible for the people who live there. Thanks so much to both of you for joining me.
Thanks, Josh.
Thanks so much.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.